We're here to provide an update on the healthcare professionals' vaccination reporting. In October 2021, Dr. Henry created a new order that requires all professional health colleges to provide personal information about their registrants to the Ministry of Health. This order impacts 18 colleges. We've made the commitment to share the aggregate vaccination rates by professions, and this is why we're here today. The goal of sharing this data is to make sure members of the public have the general vaccination information they need to help them make informed decisions as they seek treatment or services from a regulated health professional. Data that we're reporting on today are for 17 of the 18 colleges. About 94% overall have been vaccinated or are medically exempt. I just want to note on the 17 or 18 side, we're not reporting data from the College of Nurses and Midwives today, but you do have very significant information. We know that the vast majority, and I mean the vast majority of nurses, work in the public healthcare system, and the vast majority of those nurses have been vaccinated to the tune of 99%. So when those numbers are introduced finally into these numbers, we'll see them go up, not down. That nurses are extremely well vaccinated in BC. For those of you keeping track of these things, the highest level of vaccination is the College of Dietitians, followed by the College of Physicians and Surgeons in BC at 98%. It's expected, as I say, the data for all things, including nurses, will be available in the coming weeks. And just remind everyone that nurses represent about 46% of all those in health professional colleges. So they're about, the rest of them are about 67,000. The nurses are about 63,000. That's why it's taking just a little bit longer. I want to say two things just finally, and then I'm going to hand it over to Dr. Henry. The first is that about just under 80,000, 78,362 people in BC have received their fourth dose of COVID-19 vaccine, that the priority in the month of April was long-term care and those who are clinically vulnerable, who had received, in effect, their first or their third vaccinations soonest. Over this month of May, we're going to see a very high number of those over 70 reach 182 days and then be eligible for their fourth dose vaccination. We're going to have a week, next week in fact, when 75,000 people over 70 reach that level, and they'll all be invited to be vaccinated. And as you know, there are hundreds of locations across BC, in the hundreds, particularly in community pharmacy, some from health authorities in community pharmacy, and we encourage everyone. Haven't got your first dose, get your first dose. And happily, I'm happy to say about 1,000 people have received their first dose of Novavax since it's become available, and more are coming every day. If you haven't got your second dose, get your second dose. If you haven't got your third dose, get your third dose. That's more than 1 million people invited who haven't got their third dose yet. And of course, for those over 70, those who are clinically vulnerable, for those who are on long-term care or supporting people in long-term care, that's vital as well. So with that, it's my honor to introduce Dr. Bonnie Henry to share a few words.
Thank you very much. It's been a while. And thank you. As you know, we've been on a long journey around vaccination, and we have safe and effective vaccines that have really changed the game for us. As you know, in October, we issued an order around hospital and community healthcare and other services COVID-19 vaccination status, and that meant that people can be reassured that in our public healthcare system across the board, from hospitals to community to long-term care settings and public health settings, everybody who they receive services from is vaccinated and protected. And these orders have helped protect our healthcare system by ensuring that we have that high level of coverage in these essential healthcare settings. And I just want to express my gratitude to my colleagues across the board for stepping up. We also recognize the important role of healthcare providers not covered under that order, and that's why we put in place this information, primarily, firstly, an information status and prevention measures order that applies to regulated health professionals. So BC, as every other province in Canada, has a Regulated Health Professionals Act that creates what we call a college. And I'm expressing this because I've had some people explain to me that they're confused about what this is about. So the colleges, so the College of Physicians and Surgeons, for example, is the body that's responsible for licensing and establishing standards of practice for physicians and surgeons in the province. And the same happens for the other 18 colleges that we have in British Columbia. And they have an important role of, as I said, establishing these standards of practice, ensuring that people who are licensed to practice as a regulated health professional meet the standards for licensing, and their primary role is protection of the public. And this is what a profession is having a self-regulating body with the focus on protecting the public. So I've been working, in my office, have been working with each of the colleges to first understand the vaccination status of all of the registrants, so all of us who are registered and licensed to practice, and then to develop the standards so that we can ensure people can make their own informed decisions about whether to receive in-person services from a regulated health professional. So not surprising to me, much like other British Columbia residents, there is a very high degree of COVID-19 vaccination coverage amongst all regulated health professionals in British Columbia. Among practicing regulated health professionals, 93.9% have completed the at least two-dose vaccine series or have a medical exemption from my office as of April 25th. So as the Minister indicated, we have not yet got the final numbers from the College of Nurses and Midwives, and this is because there are so many registrants, and it is a process, and I've mentioned this before, that it was a lot more challenging than we initially thought in terms of being able to link people and then determine and have the colleges reach out to each of the registrants for whom they did not yet have information on vaccination status. So the aggregated data that we're putting out today likely underestimates a little bit vaccination coverage, mostly because, as we mentioned, the College of Nurses and Midwives have had some challenges in getting the status. And there also is, we have a column where people are either known to be non-vaccinated or for whom we don't yet have information. And as you are probably aware, there's new registrants, new people coming in to practice in different parts of our health system every year and every month. And so it takes some time for those to be updated. But what we do know, as was mentioned, the College of Dietitians, so people who work in our dietary world across the board, and the College of Physicians and Surgeons are the highest rates at 98%. And the College of Occupational Therapies is close behind at 97%. And we've put out a list so people can see. And this is, will help you understand that the levels of immunization are very high in most of the registered health professionals. Practicing registrants who are least likely to be reported as fully vaccinated are the College of Naturopathic Physicians, the College of Chiropractors, and the College of Traditional Chinese Medicine Practitioners and Acupuncturists. And there's some variation between each of the regulated health professionals amongst those colleges. But I will say that I am very proud that all of these are very high rates of immunization, and I think we can be reassured that across the board, regulated health professionals understand the value of vaccination in protecting both themselves, the people they work with, and the people we care for. We will continue, my office, to work with each of the colleges to ensure that we have standards in place so that people will be able to make informed decisions as they seek treatment from individual practitioners across BC. So because we have this very high rate of protection from vaccination, it has meant that we have weathered this Omicron storm over the last few months without overwhelming strain on our healthcare system that has been seen in some other jurisdictions. But it has not been easy in any way, and I cannot imagine where we would be if we had not stepped up across this province to thank everyone who did their bit by getting vaccinated. This has allowed us to remove restrictions and get back to more of those important, essential social and other activities that we love, and to come together again. But we know that hospitalization and infection rates from the data that we put out, they've leveled off somewhat But we are still in this pandemic, and we know there are still strains on the healthcare system. And as we come together more frequently with more people, the virus has more opportunity to spread. And we are seeing that. I don't think there's anybody that I know, certainly not in this room, I don't believe, who hasn't known somebody who has had most likely Omicron in the last few months. We also know that the protection from 2 doses of vaccines or from recent infection does wane over time. And particularly for milder infections, it is still a very strong protection that we are seeing against hospitalization and severe disease. But now is more important than ever to get that booster dose. And I encourage everyone who has not yet received that dose to get it now. It is not too late. If you've had an Omicron infection in January, February, you're now at a point where you need to get that extra boost as well. We continue to see circulation of BA.2, and particularly the strain that is even more infectious, the BA.2.12. We see that in certain areas of the province more than others. And we are also seeing some other variants like the BA.4 and .5, which are seen in other jurisdictions as well. What we know now, in reality, is that 3 doses of a primary series of vaccine is needed to protect against Omicron. And yes, it does increase our protection against infection, even mild infection. And it also boosts that protection against severe disease and protects you from some of the long-term complications of COVID-19 that we are seeing even young people with milder illness can experience. I also would encourage everyone who is 70 or older, First Nation, Métis, and Inuit peoples in British Columbia, 55 years of age and older, and people with immune-compromising conditions, so our CEV groups, to get their second booster or 4th shot. We know that also makes a difference right now. We need to be aware that the SARS-CoV-2 virus is still circulating around the world, and I don't need to say that. This virus is pernicious and it's changeable. So while the level of immunity that we have from recent infection and from the high rates of vaccination we have here, and the fact that we're entering the spring and summer season where we know there's a bit of seasonality to this virus spread, means we will likely have some reprieve in the next few months. But we need to plan for what's coming, and particularly I'm concerned and working with my team to look at what are the possible scenarios that we may face given our situation, our demographics and our immunity levels here when we get into the next respiratory season in the fall. We will need to manage influenza. We're starting to see a bit of it now, but influenza will come back in the fall now that we're traveling more, now that we're connecting more. And we'll have on top of that the usual things that we see like RSV and also COVID. This virus is going to be with us for some time. We do not yet know if all of us will need another dose of vaccine come the fall, or if protection from the 3 doses will carry most of us through, and only some people will need another dose. Those are the things that we are planning for the future. We're watching closely and we're planning for how that will happen now. We have come through this latest challenge because people in BC have continued to take those measures to protect themselves, their families, and their communities. Our weekly surveillance reports gives you the sense of what I call our COVID climate, where we are facing, what are the trends that we're seeing right now over time. And then every day we need to monitor the weather in our own context. That means asking ourselves, am I up to date on my vaccinations? How am I feeling today? If I'm not feeling well, I can use the rapid tests that are available, and I encourage people to pick those up. They can help. But it also is about taking that responsibility to say, if I'm not feeling well, what am I doing? Who am I going to be with? And maybe I need to postpone a visit to an elderly relative until I'm feeling better. Or if there's people in my close family or social circle who I know have COVID, then we need to take a step back from some of the riskier activities. If I'm going to be in an indoor place with a lot of people that I don't know for a longer period of time, then bring a mask and wear a mask. That will protect you and it helps protect others. We are transitioning through this emergency phase of the pandemic, But we still need to be vigilant, and we still need to be aware of the things that we make a difference both for us personally and for those around us. We're not through it yet, but we are making a difference, and we need to continue to support each other as we have throughout this very long storm, with compassion and with kindness. Thank you.